Welcome to the Simulation Center at the University of Alaska. My name is Marissa Corello, the simulation technician providing your tour. You may be familiar with where the Simulation Center is and have an idea of the activities or services that are available, but haven't yet seen the facility in person. Let me show you around. In this high-fidelity patient room, Laerdal's Sim Baby is the usual patient. We've named it Minnie, which can stand for Mary or Kenny, depending on the scenario. To name a few of Minnie's features, you may auscultate heart, lung, blood pressure, practice airway occlusion and intubation, monitor ECG, cyanosis, a bulging fontanelle, and seizures. Oh, and of course, Minnie cries too. And in this patient room, we have Laerdal's SimMan 3G. Similarly to Sim Baby, you can auscultate heart and lung sounds. You can also auscultate bowel sounds. You can check the various pulses, pedal, popliteal, femoral, radial, brachial, and carotid. You can monitor his blood pressure, pupillary responses, practice airway occlusion and intubation, monitor ECG, cyanosis, and seizing. SimMan 3G also has the ability to bleed, cry, sweat, froth at the mouth, and urinate.
Go away.
And communicate too. Simulation does not only include high-fidelity mannequins like SimMan 3G or Sim Baby. We also use a variety of low-fidelity, static equipment of chest and arms, and medium-fidelity, vital sim mannequins that feature lung and heart and bowel auscultation, blood pressure monitoring, intubation, and catheterization practice. The low and medium fidelity simulation equipment are primarily set up in your skill labs, but vital sim mannequins are often used in the high fidelity simulation rooms too. We have the simulation room set up with areas to mimic the hospital setting, such as the supply room and medication room. Although we have most of the supplies needed for each scenario in the room, the learners can still delegate another person to gather additional supplies if needed. Medications are located in the mini med bins, with a variety for the students to select from, in addition to other various supplies in these drawers. We've added supply bins that allow students to use their assessment, critical thinking, and technical skills. We provide bins for oxygen, wound care, tracheostomy care, IV therapy, and catheter care. Additional features in the simulation room include a crash cart with necessary drugs and supplies needed for a code simulation. We also have an X-ray lamp, a patient monitor, an oxygen panel, assessment panel, and a phone that allows your students to call any provider that they need during their exercise. You, of course, on the other side of the one-way mirror playing that provider. An important aspect of the simulation experience is the debriefing session that occurs with your learners and you. During your simulation exercise, the learners are audio and video recorded. There are cameras and microphones mounted in the ceilings of the sim labs that record their performance and interventions. At the end of your simulation exercise, the recording will be played back for your learners and you for debriefing and guided reflection on the learning objectives that were set. Not to worry, the recordings are deleted immediately once your debriefing sessions are completed. How are Sim Baby and SimMan 3G, the high-fidelity mannequins, operated? These mannequins require computer operation and are run by simulation technicians like me, with you being the content expert, providing direction to physiological changes that occur pending interventions performed or not performed by the learners. And how is the Vital Sim, a medium fidelity mannequin, operated? Vital Sims are easier to operate with their handheld remote. Most faculty are comfortable running this mannequin, and a simulation technician is not often needed once a tutorial session has been provided. That wraps it up. If you're interested in applying simulation exercises to your coursework, we have existing scenarios available for review, or you can meet with the Nursing Resource Center coordinator to develop a scenario to meet your objectives. You can contact us at ihsss@uaa.alaska.edu or 907-786-4565.